Welcome to our first module, Introduction to First Aid. This is part 1. The definition of first aid is the immediate help given to a person who is injured or has suddenly taken ill before the arrival of medical aid. That means you are the first person to go and provide assistance to a casualty before an ambulance comes or before a doctor is able to help that person. What are the aims of first aid? You can remember them with the 4 P's. First P will be to preserve life, prevent injury, promote recovery, and provide comforts and relief. Let's go into greater details. The first P, preserve life. How do you preserve life? You ensure the airway is clear. That means you ensure that the person can breathe well. And if the person has stopped breathing, perform CPR. Now, because you are a child, you are not required to perform CPR, but if you know how to do CPR, you can guide the adults nearby and teach the adults how to perform CPR. Number 2, prevent injury from worsening. That's why we provide first aid. If the person has a dislocated shoulder or has a fractured arm, you can actually bandage the person first before the ambulance comes. Okay, promotes recovery. Now ensure that the casualty is comfortable and monitor vital signs. That means check that the casualty is breathing well and check his temperature. And provide comforts and relief by assuring the casualty. Sometimes the casualty or the injured person is so severely injured that there is nothing you can do other than assuring the casualty that you have called the ambulance and that help is coming. So this is the basic role of a first aider: to get help, call 995 or go get an AED, which is what you can find them usually at the lift lobbies, and we use them to jumpstart the hearts if the heart has stopped beating. Children should not be using the AED, but you can go fetch an AED for adults who needs it. And you organize care and prioritize injuries. You make sure you treat the bleeding first, so you stop the bleeding before you bandage any fractures. So that's what you have to know, which is more severe. What do you do first? And you sustain life, perform CPR if necessary. Again, that's for an adult who has to perform CPR. Observe and monitor the casualty till medical help arrives. For your own personal safety, do take note. As a first aider, we protect ourselves first. You must wear gloves before you touch the casualty, and you need to avoid contact with any body fluid such as vomit, blood, mucus, saliva, etc. If you don't have gloves, you can't touch the person at all. But if you have gloves and the person is bleeding, of course, you can take a gauze. After wearing gloves, take the gauze and you do your best to stop the bleeding. On your own, you should always cover any open wounds or cuts that you have on your fingers. Now, and then use a pocket mask or face shield when giving CPR. This we no longer do mouth to mouth, as in literally mouth to mouth. As you can see from the pictures, we do have a face shield or a pocket mask in which you can put over the person's mouth to perform CPR. Again, I know I'm nagging, but children are not supposed to do CPR. Okay, and wash your hands and soap immediately after giving care. And point number 6 is a no-brainer. You do not eat, drink, or touch your mouth, nose, or eyes when giving first aid. I mean, I've never seen someone bandaging another person while eating crackers at the same time. So, yes, don't do that. If you're bandaging that person, just bandage. Don't do anything else. For emergency, you have to call 995. Okay, like any traffic or work site accidents, that means construction site accidents, broken bone or dislocation of your shoulders, sudden stomach pain that doesn't get well, uncontrollable bleeding, sudden severe chest pain, or breathlessness. Okay, for non-emergency, you do know that we don't call 995 for the ambulance. We just call 1777. There will be operator to answer your questions. That's when you have a mild fever, cough and cold, small cuts or bruise, superficial burns or scalds, or small rash or insect bites. But my suggestion is this: do not call 1777. Tell your parents or tell whoever that's taking care of you at home, your grandma or your helper, that you're not feeling well, and then let the adults in your house decide what to do with you, where and whether to take you to a doctor. Okay, again, when you call 995, if unfortunately one day you are at home and someone in your house is severely injured and you have to call 995 yourself, remember you got to identify yourself. You have to say, my name is Mary Tan. And then usually nowadays we don't have to provide a contact number, but just in case your house phone has a caller ID, that means your phone number is blocked and other people can't see your phone number, you will have to say your phone number so that the operator can call you back if they cannot find you and the casualty. And of course, provide the address. You have to say where you are. Even though nowadays they can track you, it is faster if you just say that I'm right now at block 156 Bedok South Avenue 3's void deck. Okay, so you need to provide the address as clearly as you can and describe the patient's signs and symptoms. You need to, if possible, be able to say that, okay, there is a man probably above 50 years old. He's Chinese and he's suffering from severe chest pain. And you can only hang up after the operator has ended the call. Never hang up before the operator in case the operator has something to tell you. Okay, and then you will have to wait for the ambulance to come or get an adult to wait for the ambulance to come. All right, let's talk about the first aid kit. Now, as a first aider, obviously we need to know where to look for the first aid kits. First aid kits are available throughout the school. Okay, you can see them at the computer labs, you can see them at ISH, you can see them outside the canteen, you can see them also at the basketball courts. And also if you go to a shopping mall, the first aid kits are always at the receptionist. And if you go to a stadium, the first aid kit is always available, so you can always find them together with the AED. Now, you need to recognize the medical emergencies. A minor pain, like you had a paper cut, is not a medical emergency. A medical emergency happens when there is a sudden or severe pain, a level 9 or level 10 pain. If you have the kind of pain that's from 0 to 10, 0 means absolutely no pain, 5 means it's quite painful, you need some medicine, 8 or 9 or 10 means it's so painful you need to get a hospital and get help immediately. Okay, point number 2, breathing difficulty or shortness of breath, it's always a medical emergency. Uncontrolled bleeding, sudden confusion, sudden dizziness, numbness, weakness, or vision change. You can see and then after that you can't see clearly anymore. Your vision, not that it's just slightly blurry because you have watery or itchy eyes, but that your vision is totally different. That the world started getting darker, or you see lots of stars, okay, or you see double vision or triple vision. That's when you know it's a medical emergency. And coughing out blood or vomiting blood, of course, right? That's blood. You have to call 995. Or continuous vomiting or diarrhea. Notice the word continuous, not like you vomit once a day and then you call 995, but like you have vomited maybe 4 or 5 times within a day and you're still not getting better. That's usually when you tell your family member, which will be your parents, that you need medical help.